Hello everyone, this is Dr. Schroeder with this week's video introduction, week number 4 of our class in nursing research. And we're moving along at a pretty good clip. Some good discussion and some good learning has been going on this week. And I've appreciated being able to participate along with the discussions we did this week and have enjoyed seeing so many of you get a few little epiphanies or some new understanding into this whole concept of what research is all about. And to just paraphrase a little bit or to summarize, of course, we started with our discussion in class with the talk of the differences between qualitative and quantitative research. And through this week, we've been building about talking about how there's a different purposes for different types of research. Not all research is created equal, and not all types of research are meant to do the same thing. The analogy that I use here is it's kind of like, you can have, some authors write books, some of them write fiction books and novels, others write autobiographies and, historical books or textbooks. They're both books, they both use pages, they both use the English language. However, the rules and conventions for each one of those are completely different because the purposes are completely different. Likewise, when we're talking about whether we're talking about a qualitative or a quantitative study or a mixed study or these other different types of hybrid studies out there, they all have a little bit of a different purpose, and therefore the rules are a little bit different. One of the ways that the rules are different is the way what we've been talking about this week is that describing the significance and the problems being addressed. In very general terms, when we're looking at a qualitative study, usually the research problem is something along the lines of we know very little about something, or that there are gaps in the literature about a particular phenomenon or a particular behavior or something like that. In a quantitative study, usually the research problem is that we do not have an effective intervention for, or questions exist about which intervention is most effective in a given situations. And of course, as we've been talking about, quantitative studies, if you're going to be showing a cause effect or show that one thing is more effective than another, you really have to have that quantitative piece to it. Anytime that you use words like if you're looking for an effect, an effect, by the way, with an E, not with an A, that's something different. So anytime you're looking for an effect, or anytime that you're looking to see a correlation, or how one thing relates to another, that is by design and by definition a quantitative study. You can't do that qualitatively. Qualitatively, we can find more about things, and therefore, because of that, the significance also is oftentimes a little bit more vague in a qualitative study, because sometimes just not knowing about something that can be significant. In Beck's study, the real question is what is the lived experience like for these women that have maternal depression or have post-traumatic stress? You have to kind of read between the lines to really see that there's a significance there. She doesn't come out and explicitly state it. And that is not only allowable, it is actually fairly common in a qualitative study. As long as when you get to the end of the study, when you listen to the discussion of what the researcher found, oftentimes that's where the researchers will really describe, here's why this is important. Let me tell you why this is really important, and here's what we should do with it next. When in a quantitative study, it's usually a little bit more straightforward. In the Kokaba et al. Study, we're looking to see if hand massage improves comfort. This is really the mission of, or the whole life work of Kokaba. Her whole focus and her nursing theory is on comfort measures and comfort in patients. And so here she's looking to see how can we distill this down into it? Can we distill this down to a really simple little hand massage? And a very limited study, a very small population, or excuse me, a very small sample. And you found out there really wasn't much correlation. It doesn't mean it's not an important study, or it doesn't mean that it's not useful information. It's just that the problem was very straightforward. The problem is comfort. Patients that are dying, patients that are in hospice are often challenged with having their comfort needs met. So the question is will this intervention help with that? A problem statement is usually much more broad than a purpose statement. A purpose is something that is specific towards or the significance is something that is very specific towards an intervention or towards a particular behavior, where the problem is a little bit more, much more general. And so anyway, that was, again, a very good discussion this week and moves us into week number 4. And week number 4, we're going to kind of continue on and talk not only about significance, but we're going to go to the next level, which is we're going to start to introduce the concepts, something we really haven't talked about much lately, of variables and what are variables and how do variables, how did they vary from one type of research to another? And again, this is important to realize that qualitative studies and quantitative studies, we talk about these terms variables, they mean different things. And so we're going to be discussing that in class this week. And also this week is due your midterm exam. Of course, this is on your statistics homework or on your statistics questions. That exam will open for you on Tuesday evening. I believe I have it set up to open at 6 o'clock, and it will close on Sunday night at midnight. Technically, I think the campus says that we're supposed to keep it open at a minimum from Wednesday until Sunday. We've used different dates throughout the program, but to kind of sort of hold it to just a little bit more than that 5-day time period, you have until the end of Sunday to go ahead and take that. So I encourage you not to wait too long to take it. You want to take it fairly soon or fairly quickly. You want to definitely make sure that you get it started before Sunday. And if you have any problem at all accessing, please send me an email immediately. Send me a text or a phone call using the cell phone number that I gave in class, because I want to make sure that we get that fixed for you if that's the case. If you have any trouble accessing that at any time, please let me know. You'll see an announcement come up that it will be available, and again, it will be available on Tuesday and stay available through Sunday at 11:59. And you want to make sure that you give yourself the full amount of time to take that test as well. When you open the test, it will open up for you all at once, not one question at a time. So you can kind of sort of go through and breeze through and look at the questions, answer the ones that are easiest for you to answer, and then go back and spend some more time on the ones that are a little bit more challenging. But that's your primary work for this week, is the discussion question and the test. And also you'll see that starting next week, you have a research analysis. The first one, I believe, is the quantitative study. I think is the first one we'll be doing. I'll be talking about it more next week, but please open it up and look at the rubric for it this week, and look at what is required, because it's a little bit more time consuming than it looks. It looks like it's a fairly simple assignment. Actually, it takes quite a bit of time to do. That's why we actually say start to focus on it this week. You'll be given a article that you need to read, a research study, and then go through and look at the different points of that critique. And I'll be talking about those critique points a little bit more, but this week you want to at least get a good idea of what is going to be required for that. And it will be due next week, but we want you to get started on it this week, though. So I look forward to participating in class with you once again. If you have any questions, please feel free to go ahead and let me know. I'll be happy to address any of the concepts, any of the terms, any of those things here, either in video or in written form. So I look forward to seeing you in class. I hope everybody does well. We'll look forward to seeing you in discussion forums.